Welcome, everybody. We're going to wait a few minutes before we start. All right, we will get started. Thank you all for joining. And we are happy to have you here today after last week's panicky debacle, which everyone was probably very confused what's going on and waiting, and we couldn't get it to work, and we were relieved to see that it was a national problem, and happy that you're able to join with us today. I am Wendy Chapman. I lead the Center for Digital Transformation at the University of Melbourne. So I wanted to start with, why are we offering this course? And we've been going around doing a lot of needs analysis with health services. And the number one message that we hear from them is that we need a critical mass of people with the skills to build a learning healthcare system if we're going to reap the benefits of the digital transformation of healthcare. And so all the things that we want to accomplish in bringing data and digital innovation to healthcare just can't be done unless we have more people who understand the principles and are able to bring those principles to work with them. So in this session, I'll be describing the course. I'll first introduce you to the instructors. We'll talk about the curriculum. I'll talk about the methods that we're going to use in teaching this short course. Say a little bit about expectations from students and what we think that you'll get out of the course, and then describe the selection process. At the end, we'll have time for questions and answers, and those can be entered anytime through the Q&A. All right, there are a lot of people working on this course because this is a very interdisciplinary project. The reason there aren't learning health systems everywhere around us is because it's really complicated, and how to put it in place requires a lot of different types of expertise. And so we have a set of core instructors who are developing this, and we have a lot of subject matter experts from University of Melbourne, from different health services, and even from other universities and CSIRO contributing to the content. So what's this course going to be like? You've seen this on the flyer, that we're focusing on. There are many models for learning health systems, and we're calling it learning healthcare system because we're really focusing on that interface between the patient and the healthcare system and trying to build a more connected experience for patients while supporting decision-making between the patients and the clinicians. So we are focusing on improving clinical decisions that improve outcomes, and that involves data, collecting, wrangling, analyzing data to be able to gain knowledge from it and to help us decide the types of solutions that we might need. So building new innovative models of care to deliver the right information to the right people at the right time, and then implementation and evaluation and collecting data and knowledge from what we've put in place so that we can learn and continue to improve. So this is the model that we're using. And there are the three different sections: data to knowledge, knowledge to practice, and practice to data. So I'd like to introduce you to Douglas Perez, who is going to be teaching the data to knowledge section. And if you do a little brief introduction of yourself, Douglas.
Thank you very much, Wendy. Welcome to everybody. It's a pleasure to be here. I'm Douglas Perez, and I'm the center's co-lead for data science and health informatics. And I specialize in machine learning and applying it to clinical data. I will be one of the instructors for the data to knowledge aspect of the course, as Wendy mentioned, together with Associate Professor Brian Chapman. So what we're gonna do. So data to knowledge has mainly two components. And the first one has to do with research-ready data and what we need to do for data to become amenable to inquiry. So we really need to understand that using data and learning from data, it's not like putting gasoline in a car. More than often, available clinical data is crude and it needs to be refined, filtered, transformed in order for it to become useful. In other words, research ready. Sometimes we need to go electric as well and find other sources of data and integrate them. So in this stage of the course, the first stage of the data to knowledge part, we will discuss questions including how data is captured and how clinical data is stored, but also discussing data quality and how do we go about cleaning and transforming data to make it ready for analysis. And we'll also discuss how to define what's called the digital phenotype. The second aspect, the second component has to do with, given that we now have research-ready data in hand, how can we leverage it? How can we learn from it? And what can we learn from it? So this will involve, in a first stage, applying data science and data analytics that will allow us to inquire data and investigate particular problems and questions retrospectively using historical data. And however, we need to go one step further. And we want to go from analytic to predictive, how to look into the future, not only retrospective. And during this course, you have the opportunity to have hands-on experience with training, evaluating, and validating, perhaps your first machine learning model and discussing its utility in a real-world application. And throughout this course, we will also discuss things like data governance and standards for data development. Thank you, Wendy.
Thank you, Douglas. All right, so by the end of the D to K section of the course, you will have learned about a particular cohort of patients, and now you will be thinking about how do we help those patients? Now that we understand more about them, then how do we build some kind of a new solution to support them? Oops. And that's the knowledge to practice. So I'd like to introduce Kit Huckvale.
Thank you, Wendy. Hello, everyone. My name's Kit Huckvale. I'm a research fellow in digital health in the centre. My areas of interest are around digital phenotyping and using smartphones for delivering healthcare interventions, and also contributing to the large-scale evaluation of new healthcare interventions. So yeah, I'm going to be running this part of the course. And as Wendy said, it's all about, what do you do when you think you have an idea to turn it into reality? So we're going to be taking you through with a really hands-on approach, thinking about, how do you identify solutions and how do you weigh up the information you might get from different stakeholders like patients and carers and other consumers, as well as healthcare professionals, to choose the best solution for your problem. And we'll introduce you to some techniques for assessing and choosing amongst when you have different solutions on the table, and also thinking in a structured way then about how do you actually then fit that into care. And in particular, thinking about clinical workflows and how you map the way that information might be needed to deliver different aspects of that treatment or intervention. And in the second part of this part of the course, we're going to give you a chance to get really hands-on with some cutting-edge clinical tools that involve using data and transforming it in different ways to drive different clinical workflows. So you'll get a chance to test out some of the solution ideas that you've been thinking of, evaluate them, and think about how you can then feed that back in a structured way to improve and iterate on your treatments and interventions that you're developing.
Thank you, Kit. Next, you will have come up with a solution, built a pilot version of it, and now you have to think about how are you going to learn from what you put in place to improve it. So Kathleen Gray.
Thank you. Thanks, Wendy. Kathleen Gray, I'm a professor of health informatics, working in the Center for Digital Transformation of Health with my colleagues. I'm very excited about this new direction in our education and workforce development strategy, and very pleased to be co-leading this phase of the curriculum with Associate Professor Graham Hart. And there are lots of metaphors for this phase of the learning health system. In innovation, sometimes this is called the valley of death, not a clinical term, but when things just can't, they look really good in the pilot stage, but they just don't work in the real world. And another long-standing joke is that in digital health, there are more pilots than Qantas. So many of them just don't succeed and thrive and scale. So this is another metaphor where the rubber hits the road. So in this phase, we will consider what an evaluation plan should look like so that we know whether what looked feasible, as Kit just described, actually turns out to be feasible in real context. And that will look at clinical evaluation, modeling the phases of clinical trials, but also evaluation in terms of other health system performance factors such as access and equity, sustainability, continuity of care, and so on. We will also be formulating an implementation plan. How you engage all of the stakeholders, how you deal with the unexpected, and I suppose last week's failed orientation and information session is a classic example of you think everything is going to go smoothly and it doesn't. So implementation planning will consider people factors, the human behaviors, also processes and governance factors, and technological factors. And in this part of the course, we'll be practicing working through some unexpected situations that have come from real-world war stories that our colleagues have contributed to us when things haven't gone to plan. And we will also be taking the learning that happens in this phase of the learning health system, which is learning about what success looks like, learning what we want in the longer term from our transformation. And we'll be using various ways of measuring success, learning from our experiences, including things like digital maturity models and unfolding digital health strategies. Thank you.
Thanks, Kathleen. Excellent. All right. So how are we going to do this? It's 11 weeks. It's a lot of topics. So first of all, it'll be Tuesday nights starting at 6:30. We will have 2 hours and 15 minutes, and we'll have a 15-minute break in between hour 1 and hour 2. It'll be taught fully online via Zoom. We are going to be using active learning. So you will be doing work beforehand that will prepare you for the in-class activities. And in those, a lot of the time will be spent within a smaller team, which we are going to call a simulated learning community. And you will be doing some hands-on discussions, playing with data, experimenting, making decisions, pitching things. And so you'll be really practicing a lot of the things that you have to do within a learning healthcare system. The way we're going to tie this all together is that we're going to have a single scenario that's the backbone of the course. And that is helping people with diabetes better manage their condition. And so this will stem from a real situation. We will use data from real clinics and real hospitals. And we will use a case study of a digital intervention, a digital solution that's been developed and implemented and piloted so far, so that we can, along the way, as you're making decisions and learning about what to think about as you go down this pathway and this learning health system cycle, that you will be, will have a real example to draw on and learn from. So because it is, 11 weeks and has a lot of different topics, it'll be very broad and it will be taught like a baking show. So you think about the picture of the cake indicates that, you're going to be doing things, you're going to be making decisions, but it's like you at home trying to build, cook your cake. And so you're going to be mixing things, but then we're going to pull a cake out of the oven and say, this is what we're going with. And look what you did. And now we're going to talk about the shape of the cake and the frosting, and then you go to the next section and you're going to do some interactive things and some decision making, and then we'll show you the frosted cake and so on. So you will be able to interact with real de-identified patient data using Jupyter notebooks. Those are it's a website that you would go to where you can interact with the data, you can view it, you'll be able to make changes and without needing to know how to program. And so Jupyter notebooks, if you want to look them up, they're very cool, and it's a way to really interact with data without programming experience. We will be doing user-centered design and really learning about what do clinicians and what do people with diabetes, what are their needs, what are the ideas that they have for solutions. But you won't be actually doing the design sessions with with these people. Instead, we will have done them before class, and you will look at the artifacts from those and have those inform your decision making about the types of solutions that you think we should implement. You'll be developing software, but again, you're not going to be coding or building things from scratch. We're going to be using a drag and drop platform that will help you be able to really quickly create apps and dashboards. And then you'll be implementing and evaluating, which of course you won't be doing in real life, but we will be reviewing the evaluation that's been done for the case study and talking about how we would add to that and developing implementation plans and discussing what we learned from that. So that's how we'll be touching all of these things in a very broad way. All right, what's expected of you? We will have a brief orientation that you will complete about handling human participant data beforehand, probably take 30 to 45 minutes to complete that. We're going to have a pre-launch meeting the week before at the same time. It will be 1 hour, but kind of an orientation. And you will be doing preparatory work before the first session and before every session. We expect the people who are signed up for this to attend every week, understanding there might be emergencies, but with, that you have the plan to attend every week and hopefully the capability. We'll be spending 2 hours in class. You'll be spending about 2 to 3 hours per week preparing for class, and you'll be part of the simulated learning community. And so you'll be interacting with them and contributing your ideas and your feedback. And mainly, we need people who are curious and who are willing to be challenged. And I say that because nobody who comes into this course will understand all the parts of it. And so you are going to be challenged. You're going to be an expert in some area that you bring to the course. And first, we want people who will own that expertise and say, yes, I do have expertise in a certain area, and be confident about that. And then say, there's a whole bunch of things I don't know. And as we dip our toes into all these different areas, it's going to feel a bit frustrating, perhaps. And so it is going to challenge you, I think, because it's going to be a lot of areas that you're a novice in. So being able to balance that. Curiosity will be really important, that learning and what is it that I don't know, and how can I interact in a way, even though I'm a novice at it. This is something I face in life all the time. You become an expert at something, and then some new situation and you feel like a novice, and it can feel threatening. So I want you to be prepared for that. And we are going to be requiring frequent feedback from you, because this is a pilot and we want to learn about how we can improve it. And so there will be surveys that you'll take, and every week you'll have a short survey about what worked for you, what could we improve. There will be something after class to learn about what you've learned, and some people will be able to sign up for an interview. So you will be giving us a lot of information to help us not only in the content, but also in the way that we have approached and taught the course. So what is it a pilot for, you may ask? And there are several things that we will offer this short course in the future, and so we want to improve it. Also, we're going to launch in February what we're calling the Learning Health Academy. This is a program that we are running with the health services, and it'll be a year-long program, and 3 months of it will be the content of this course. The remaining 9 months will be spent working on a project, being mentored by various experts at the university and in the health services. And it will be something that will be driven by the health services, and they will nominate people for this course. So it's not something anyone can sign up for. It'll be a very small group and a very mentored initiative. But this coursework that we're going to be piloting with you will be expanded and used within the Learning Health Academy. Also, we would like to create award programs from this, maybe a professional certificate, and who knows, depending on the market demand, but award programs at the University of Melbourne that you could, get an actual degree or award from. And so, thinking about how we might take what we are doing here and grow that. So because you will be providing us a lot of valuable information and we'll be putting a lot of burden on you to give us feedback, then we will be waiving the tuition for this pilot. All right, so what do you get? Well, hopefully, our goal is at the end of the course, you'll be able to apply the principles of the learning healthcare system in your life. You'll be able to plan for productive analysis of routinely collected patient data, apply practice-based evidence to design decision support solutions, manage for greater digital maturity, and prioritize your learning needs. So hopefully you'll identify areas that maybe, what's the part of this learning healthcare system that's your passion and that you want to learn more about. You'll get a principal certificate of completion from the University of Melbourne. It won't be credited towards a degree program, but you will have a physical certificate. Okay, so how will we select people from these EOIs that we have asked for? There's two major criteria. You need to be committed that you'll put the time in for this and really come to it with all your heart. And the second thing is that you need to have had some experience with healthcare. It doesn't mean you have to be a clinician. There's all kinds of ways to have had experience within healthcare. And so we want representation from all of these groups here to be part of this course, because there's the learning healthcare system that we're talking about, but the idea of a learning health system, which could be, a Victorian learning health system or a national learning health system, is a really important thing to think about. And it involves policy, and it involves IT, and it involves, regulations. It involves all kinds of things. And so we need people with all different types of expertise thinking about the issues to be able to really transform our system. We will select 50 students from the EOIs, and our selection criteria, area of expertise will be important in that we are going to create these learning communities. We want them to be diverse. And so we want each learning community to have a representative from one of these areas on them. Also, we want to have strategic partners who we are trying to build partnerships with. So health services, government agencies, and businesses that we have been working with for the last year and have helped really guide us to the development of this course based on the needs analyses that we've done with them, that we want to include them. But we want to have many partners. And so rather than having 10 or 15 or 20 people from one institution, we'll have a smaller number so that we can get a broader representation of partners. So
Wendy,
yes.
Relevant to this section, one participant is asking, do they need any baseline experience in digital health?
You do not need any baseline experience in digital health or data or clinical medicine. You just have to have had some experience in the healthcare sector, because we aren't going to explain a lot of the context of what's going on. We are going to explain the context for the use case that we're using, but not just the general health context. But there's going to be a nurse in the class in your group, and she might have no experience with data or digital health. You're going to have someone who's from an IT company who has worked, collaborated or built health apps, but really doesn't understand a lot about how the workflow is and what the pressures are on the health system. And so you're all going to bring something to the table, and you're going to learn from each other. The timeline, EOIs are due on the 10th of September, and we will send out decisions by the 17th. We will have the pre-course meeting on the 28th. The course will launch on the 5th, and it will end on the 14th. All right, with that, looking forward to the question and answer session. So I will stop sharing and introduce Kaylee Lyons and Don Chu, who are in our educational team, to guide us in the question answer period.
Wendy, we'll start with an easy one. How many EOIs have you received thus far?
We've received about 100.
Great.
Yeah.
Another participant is asking, for the preparatory work, so before the Zoom session, what will that look like? Will we be provided online readings and a topic before heading into that session?
Yes. So we are going to use Canvas for this course, and many of you have probably used Canvas or some other learning management system for that. And the information will be on there. It will be very explicit about, do this and then watch this video, and now, read this excerpt, and you'll walk through it. It'll be very clear, hopefully, about what to do to prepare.
Yeah, we'll make sure it's very clear. We'll also make sure that you have those materials released to you at least 7 days before they're due, because we know that all of you have full-time jobs, busy lives, so we'll make sure it's clear and keep to that 2 hours as much as possible. Another person asks, are there any assessments in this course?
Would you like to answer that, Kaylee?
Sure. There's no major assessments like a final exam or a big project, because this is a short course, but we will have smaller activities where we'll have you doing activities in your small group or individually, either in the Zoom or pre-class. And, we'll give you feedback on those activities either through large group feedback and some individual feedback. So no major assessments. Next question, will we be having any assignments involving class competitions?
Is that because you want them? I hope so. Well, so we're going to have these 10 learning communities of five learners each. And we will be doing a lot of comparing and contrasting of, go off in your learning communities, you come up with your ideas. And we will be, for instance, you're going to come up with a new solution based on what you learned from the data to knowledge section. And we will be rating those and selecting the winners. And then there will be small things, which Kaylee's introduced me to Kahoots. So whenever we might have little quizzes embedded here and there where we can have competitions throughout the class, but they'll be small.
Yes, and they won't be for $1 million or something, but probably just for fun. Someone asked a good question. They asked, what software systems we'll be using? Do I have to be very tech savvy?
It's a great question. So you need to know how to use the internet. And that's one of the great things about the Jupyter notebooks, and what we're going to be trying to set up the environment well for you. And maybe Douglas could talk a little bit about that for the DTK section.
Sure. So we're going to use an online platform for programming that allows the concept of drag and drop programming. So you're going to get exposed to the concepts of programming without having to explicitly do it, meaning that you're going to be able to do exploratory data analysis through the graphical user interface that is user-friendly. So even though you're not going to actually explicitly program, you actually will be able to understand the data, select parameters here and there, and see the effects and interpret the effects as well. But it's going to be user-friendly, and it won't require very much tech savvy. As Wendy said, as long as you can navigate a browser, that should be fine.
And all you need is to have a browser. Kit, for the knowledge to practice session.
So that we will be using tools, but they will be extensively, supported by sort of preparatory material to get you into them. And I think, they will be new. We wouldn't expect you to know them in advance. So I think we will lead you through them.
And part of our learning will be, did we lead you through them?
Yeah, absolutely.
Or did we overestimate how easy we made it?
Yeah.
And I think in general, our Zoom sessions won't be through a webinar. So we're on a Zoom webinar right now just because there's a lot of participants, but our regular Zoom sessions will be in a regular Zoom meeting. But there will be 50 of us. So we do hope you're tech savvy enough to just understand when to mute, when to not mute, engage with each other in breakout rooms, just clicking on links, and just probably very user-friendly tools.
Just to follow up on a related question that we have on the Q&A, since it's web-based, it's going to be friendly and compatible to Mac, PC, Linux, and so on.
Great.
Kaylee, will there be any training on Canvas so that they know how to navigate Canvas?
Yeah, I think for that first session that we have before the class really gets started, that, we could maybe, for people who are unfamiliar with Canvas, they can stay behind and get a little tutorial.
Kaylee, would you introduce yourself? Because I didn't
yeah.
in any detail.
So I'm Kaylee, and I'm a pharmacist by background, but my specialty is really in the learning sciences and education. So my role in the short course is to help coordinate it across. I'm really your advocate, so making sure that all the materials are user-friendly, leveled correctly, engaging, fun, effective, and evaluating that as we go along.
And Kaylee has just started with us, so this is all a new topic to her as well. And she's really helpful in thinking through, preparatory things that we might need for people at a level that we're not at. Yeah.
And I will say, looking at it, it looks really interesting, exciting. I've read a lot. I've been in healthcare for a while, but everything that we're presenting looks very novel, new, and useful. So it'd be really exciting for the participants. Another person asked, will we receive a certificate of completion at the end of the course?
Yes, you will. And it, like we said, it won't count towards a degree, but it will be a certificate of completion.
Another one asked, do you see this as being relevant in an aged care setting?
Definitely. I think, yeah. So there's a lot of data to be mining and learning about in an aged care setting. The scenario that we're using has a hospital, a specialist clinic, and a GP office that are kind of connected. And we'll be working on a virtual care model. So an aged care is not a focus of the use case, but you'll be able to see clearly how the things that we're doing for a specialist clinic or a GP office could apply in aged care as well.
Someone else asked, would a group of 5 need to meet to complete the coursework in between the weekly sessions? Great
question. We are trying to avoid that. There may be 1 or 2 small things that you need to do, but in general, we hope to not have any need for the teams to meet between sessions. And that's why during the sessions, the teams will be breaking out a lot and doing work together.
Along those lines, someone asked, is working full-time along this course reasonable and possible?
I think it is. I mean, so you're talking about 4 to 5 hours a week. And so 2 hours are not flexible, but the remaining 2 to 3 are. And so if you can manage that, it's still hard. I know it's hard. I did a workshop that was just like a Thursday, Friday, Monday, Tuesday. And it gave me a lot more sympathy for students trying to juggle that with the full-time job. So I know it's still hard, but there's flexibility for half the time.
Yeah, and I think for that 2 hours of pre-class, myself, another person, will go through those. We'll see how long it takes us. We'll make sure we keep to that 2 hours and be respectful of your time. But then we'll also have another section in the pre-class material for those that do have a bit more time on their hands and want to explore a bit further and can look at optional materials depending on the week and what the instructors pull together. Someone asked, where do you think this course can lead to, i.e. further studies like a master's?
Yeah, great. So you're going to identify these areas that you're really interested in. So maybe you say, wow, I never knew I was so interested in data science, but I'd really like to do that. And so there are various programs around that are online or available. Now, what we offer, we do have a graduate certificate that's available. And maybe Kathleen could say a few words about that.
Sure. Thanks, Wendy. Some of the same subject matter experts and some of the same learning resources we are hoping to take up into our graduate certificate of health informatics and digital health. But it, of course, is much more demanding in terms of time and can be credited towards a master's degree. So if someone is interested after doing our short course and you've piqued your appetite for further study, the grad cert is the best step forward if you want to dive deeper into health informatics and digital health generally. It can be done part-time over up to 2 years, or it can be done intensively as a full-time 6-month effort between July and December each year.
And this is a less satisfactory answer, but a longer term answer is that like I said, we want to grow this into its own program that's really focused on applied learning health systems. And so over time, if there is a market for it, we hope to develop, maybe even a master's degree in this topic.
Along those lines, someone's asking, is there any benefit in completing the official course if you're going to take subsequent iterations of it? Or will it just be a repeating of the course with tweaks?
You mean like if we offer this, when we offer this next time, would it be, would it be different enough that they should take it?
Yes.
And I would think no. I think that it will just be improved. But we should, follow up with us again when we get to that point.
Another person asks, is the course going to look at a particular area of diabetic health issues?
So we're using diabetes care as the scenario that's running through. We will be looking at patients who are seen at a specialist clinic and trying to determine which of them are admitted to hospital and why. And then we will be building a solution to help people manage their own diabetes better together with clinicians. So it's quite broad and we'll touch different parts, but yeah. Did that answer it?
Yeah, and another one might lead, I think this person maybe is slightly confused. They're asking, will there be potential at the end of this course for a real live implementation where applicable?
No, everything will, but what the case study that we're looking at is a real thing that's in place and is in clinical trial right now and being implemented in Queensland. And so you'll be learning about some of these real systems, but we won't be doing something where we could actually apply it.
But I guess if they do really want to implement something, that would be more for the academy later.
Well, I hope that what you take away from this course is, not only the principles and the knowledge about the things to think about and what's needed across the whole cycle, but some templates and some frameworks that if you wanted to start a project like this for whatever the topic is in your area, that you would have an idea about how to move forward on it and the types of expertise that you'd want to bring onto your team.
Great. Someone looked, is there anything in particular you're looking for in the EOI?
Your passion, your commitment, and yeah, I think just those two things.
Another one, if you've already completed the grad cert in health informatics and digital health, would this short course cover different information and be appropriate to complete?
I think it would be. In the grad cert, you will have gone into depth in a couple of subjects. And in this class, we won't be going into depth in those. So it's not that you're going to get a lot of things repeated. Instead, what we're going to be doing is connecting a lot of dots about how they all fit together from the beginning to the end of designing a new solution. Any other thoughts from the Kathleen or?
No, I agree. I would say it depends what you've been doing since you completed the grad cert. But if you do find yourself in a work situation where the learning health system looks relevant to you, or if you want to work with subject matter experts in this very case study based setting, you're certainly encouraged to put in an expression of interest.
Questions probably for Douglas. Will the program include the analysis of statistical data for the improvement of clinical utility purposes?
It will definitely include analyzing data from a statistical perspective to understand data utility, understanding which data can help us respond to particular questions or not. And what was the other bit, sorry?
We'll be looking at using that data to improve things for clinical utility purposes. So probably bettering the healthcare system.
Yeah, definitely. So the main purpose of this is to the data to knowledge aspect is trying to understand how and what we can learn from the data. And these need to be grounded into a relevant clinical question, whether that's how we better manage and handle patients or how do we optimize resources. So this is always a start with a real world problem and how we can use data and data science to answer it. So definitely yes.
Great. So one person's asking about our collaborations. Which health services are you collaborating with for the Academy? And are you planning to expand that to other services within Victoria in the future?
Yeah, so we don't have that completely answered yet, but there are going to be probably 5 hospitals, and they're MAC related hospitals, affiliated hospitals. So the Austin, and let me say that the reason we selected these hospitals to do the Learning Health Academy with are they have invested in co-hiring clinical informatics directors with us. And so we have someone that's working with our center and also working within those hospitals to help grow that area. And so that's how we've selected them. So we have we have the Austin, we have Royal Melbourne, Western, Royal Children's, and Peter Mac. And then we will also have some GP practice representation.
I think this next question is for Kathleen. Will this course also cover evaluation strategies post-implementation of the virtual monitoring platform?
The evaluation plan, yes, will be short-term and longer term. So we'll be looking at how to structure an evaluation plan that caters to how did we go in the first 6 or 12 months of implementing this in one particular setting through to the, broader, longer term goals. And this may help some people in planning to apply for funding, for instance, to do research in this area.
Yeah, and I want to have a caveat to a lot of our answers, which are, yes, we are going to cover that, but we have such a short amount of time, you can bet it's not going to be in very much depth.
Someone asked, is this course also going to touch on existing funding streams and barriers?
And I wonder if they mean funding streams for research or funding streams for new models of care.
Maybe touch on both of those.
Okay.
Yeah, and certainly I would imagine in the session that we have, one session, 1 week, where we look at ways forward. How will we know what success looks like? What will be our strategic next steps in the directions that we want to take this in? That will certainly consider how that can be resourced and how that will fit with policy and strategy. But we're certainly not offering to find you funding to take anything specific forward in this short course.
They've clarified government funding streams for new models of care, especially in public hospitals.
We will be addressing that throughout the course, because one of the things you really need to answer is, if you're going to come up with a new idea and a new model, how is it going to work in the real setting, and how is it going to disrupt what's currently there? So we will be addressing that, but not in a lot of depth.
Great. We have 3 more questions. Get your last minute questions in right now. One of the last questions, will there be an online recording of the curriculum available on Echo 360? And I think we are recording the sessions, but there is an expectation to attend every session. I'm sure if you have like something like you're sick, obviously we'd excuse that, or maybe if you have one schedule conflict, we'd excuse that. But there should be recordings. I don't know if we decided whether they'll be shared all the time. Wendy, what do you think?
Well, I think it's sometimes really useful for people to go back to them as they're working on their next week's work, and so making those available will be helpful.
Great. Another one asks, if the number of EOIs increase, will you look to increase the number of places, or will it remain at 50?
Yeah, it's a good question. We had a big discussion about the right number and there's pros and cons, and I think we're pretty settled on 50. and that hoping that there will be, you know, opportunities in the future for this course again, the new and improved version. But it's possible, but unlikely.
And last question of right now, are there plans to link the course in the Certificate for Health Informatics and links into Australian Institute of Digital Health?
Oh, Dawn, could you reply to that?
So for the current short course, we have received endorsement for 20 CPD points as part of the continuous TR program. So the TR program runs under the Australian Institute of Digital Health.
Great. Another question for the drag and drop data programs mentioned earlier. Will we be expected to purchase the software, or will we access it through a virtual portal? So I think that's to Kit.
Yeah, so it'll all be done through online cloud-based environments during the classes, and we'll also make sure that you can access them outside the class. So no installation, minimal setup. We'll just give you the login details. Yeah,
and I want to add to that about it is an industry-based platform. It's not something that will be available after the class. So it'll be disappointing that you won't be able to go apply it for what you're doing in your work. and we're trying to use open source things as much as we can, but this is really a way to accelerate, and you'll be able to do a lot more than if we had used something open source.
Okay, I think we answered all 35 questions. So Wendy, do you want to conclude the session?
Sure, thanks. They were excellent questions. We are going to do our best to make this really smooth, but I've taught enough to know that it never ends up as smoothly as you hope. Although I've never had, you know, someone like Kaylee helping me design all the materials and test them out and say that's going to take too long, or you need to prioritize A versus B, which is more important. So I think you can feel pretty confident it will be high quality. And we just really look forward to interacting with you all. And part of what we love about teaching and why we're in, you know, academics instead of industry is the interaction with the learners. And so, you know, we'll be available for, you know, talking to you about the issues that you have and you know, helping you think through your career choices as well throughout the course and building those relationships. Okay, well, excellent. Thanks. We look forward to your EOIs if we don't already have them, and you'll be hearing from us shortly.